Oxygen resuscitation provides the patient with up to 95% of oxygen and is delivered through a resuscitation mask. It helps build up the necessary oxygen levels for a patient. All oxygen cylinders have a white top or shoulder. When delivering from a full C cylinder, 440 litres, the following amount of oxygen will be delivered. Resuscitation, 15 litres per minute, lasting for approximately 25 to 30 minutes. Therapy, 8 litres per minute, lasting for approximately 50 to 55 minutes. The oxygen resuscitators should be checked regularly for cleanliness and contents. There should be weekly maintenance as well as after every use. Members must be trained in this area to use this piece of equipment and are known as the Advanced Resuscitation Operator. Defibrillator. The automated external defibrillator, or AED, is used when a patient's heart has stopped beating or is beating weakly or irregularly, that is, cannot generate a pulse. This device sends an electric shock through the chest to enable a heart to resume a functional heartbeat and should be applied as soon as possible. A trained operator is the only person that can operate the defibrillator. A defib can be used in conjunction with an oxygen resuscitator. However, the operators must make sure there is no concentration of oxygen around the casualty's chest and no buildup of gases around the scene, as this could cause a spark. The electrode pads are placed on the patient's bare chest. The AED manufacturers will have instructions for applying the pads on the pad packaging and on the pads themselves. The operator follows the voice visual prompts of the AED. On the stand clear prompt, all rescuers must have no contact with the patient. Spinal board and collars. The spinal column consists of a series of interconnected bones called vertebrae, which enclose the spinal cord. An injury to the spinal cord has serious ramifications for our ability to function normally, and an injury of the cord may leave the patient paralysed. Spinal injuries can be caused by a variety of physical incidents. In the surf environment, spinal injuries often occur when a patient hits a sandbank with their head or neck and thrusts it in a different direction. Some signs of a spinal injury are tingling or absence of feeling in the limbs, inability to move arms or legs, or absence of pain in limbs despite other injuries. A lifesaver's priority with all suspected spinal injuries is to maintain the airway, as CPR may be required. Lifesavers need to stabilise the patient as quickly as possible, starting with the head and the neck to prevent any further damage. The patient's neck needs to be kept in the neutral position where the head, neck and spine are in a position that, if standing vertical, the eyes face directly towards the horizon. A spinal board and a stiff neck collar is to be used to stabilise the patient. Box jellyfish sting. The patient will be in lots of pain and will normally be screaming. The sting site will appear immediately and look like a whip mark or frosted ladder. Reassure and try to keep the patient calm. Place the patient in a shady area. Pour vinegar over the area. Continue to flush the area for at least 30 seconds and call 000. Monitor the patient and be prepared for the patient to lose consciousness and commence CPR. Irukandji. No initial signs or symptoms. The patient may approach stating that they have been or think they have been stung by a jellyfish. Normally, the patient won't show signs until 30 to 40 minutes later. The patient can experience nausea, cramps, back pain, spinal pain, localised sweating in the area or goose pimples around the area they were stung, and anxiety and fear impending doom. Flush the area with vinegar and reassure the patient. Call 000. Monitor the patient. Circle the area where the patient was stung so that the hospital can perform a test on the sting to identify if it was an Irukandji sting. Blue bottle sting. Run under warm to hot water. The water should be as hot as the patient can stand. If hot water is not available, run under cold water and apply ice. Queensland Ambulance Service handover. Surf lifesaving members are often the first on a scene or incident. The high level of first responder training allows surf lifesavers to gain vital information about the patient that will assist the QAS when they arrive. This means the handover of patients to the QAS is a lot easier. Both work closely together, which can mean life or death for a patient.